Welcome to Burnout-Free Me, your success and well-being podcast. I'm Dr. Amy Grimm, and I am so glad you're here. Let's go from burnout to breakthrough together. Hi, everybody, and welcome to episode 66 of the Daring DVM podcast. I really hope you enjoyed the interview with Dr. Jennifer Edwards last week. She was so lovely, and I had such a fun time chatting with her. If you guys like these types of interview episodes, please let me know, and also let me know who you would like to hear from. I think it's important for us to get different perspectives from different veterinary professionals, especially those who are in potentially different career tracks, so we can have an idea of what is possible and what is out there. And also those of us who are involved in mental health. One of the ways we can start overcoming our mental health challenges in this industry is by talking about it more. So if there are any people that you would like to hear from in particular, please let me know so that I can reach out to them and hopefully set an interview up. Now, if you remember from way back when, like the very beginning episodes of this podcast, there was one in which we covered anxiety and worry and stress and fear and how these emotions are not so helpful when it comes to problem solving. We also talked about why do we even choose to feel these types of emotions? And most importantly, how can we start choosing emotions on purpose and specifically ones that actually serve us? So if you are new to the podcast, welcome. I am so glad that you are here. So great to have you here. And I would highly encourage you to go back and listen to that episode on anxiety before starting this one. The episode was called How to Stop Worrying, and I believe it was number 4. So long ago. But go check it out. It's a good one. The thing is, anxiety and stress and worry and overcoming them are such big topics in vet med. So I wanted to do a follow-up episode. And to be honest, we're probably going to cover this again in future episodes because I want to keep exploring topics that make us feel stressed. And we're going to deal with it all. So if there's something that you want to hear more about or something that we haven't covered yet but you want me to, please let me know as well. You can do this by leaving me a comment or go to my Instagram at Daring DVM, or you can find me on LinkedIn as Dr. Amy Grimm. There is also a Daring DVM Facebook page, mostly for the algorithm and because of all the hoops you have to jump through with Meta Business Suite. But Instagram or LinkedIn are really the places to go if you want to connect with me and start a conversation. So come say hi. I would love to hear from you. So for today, we are going to focus on the causes of anxiety for veterinarians. I know this can be a heavy topic for some of us, and if you are someone who is really struggling or if you're experiencing suicidal ideation, then please ask someone for help, whether that's a friend, a therapist, a crisis hotline. Whatever it is you're going through or experiencing, please know that you are valuable and loved, and things can be different. I think a really good resource for this is the Not One More Vet website because they do have an entire page with contact info and helplines for different countries too. So wherever you are in the world, help is available. So outside of the larger scheme of mental health and all of the problems that we face within vet med, I wanted to take a step back and talk a little bit about why doctors, why veterinarians in particular, experience such high levels of anxiety. What are the causes of veterinary anxiety? And this applies to all vet professionals. And if you've seen the stats, you know that in some cases our RVTs and other vet techs can be even more at risk. And because I'm a vet and that is where my experience lies, I'm going to be talking from that perspective. Yet I know this also applies to so many other vet professionals out there too. Now, you may be wondering why we're going to talk about the causes of anxiety. You're like, Amy, I already know why I'm anxious. Let me give you a ton of reasons about why I feel anxious at work. Why should I spend all this time going over things that I probably already know when what really matters to me is how do I solve it? And yes, my fantastic forward-thinking doctors, we do want to solve for it. Yes, that is true. Focusing on practical solutions is what we do. And it's actually what we do as life coaches too. So there's a very common thread between being a doctor and being a life coach. We're looking for practical solutions to help our clients. So I know that's what you want to do, and know that it is what I want to do too. And like any good doctor knows, if you want to be successful in working up a case and solving a presenting problem, it is really freaking useful to understand the disease mechanism behind it. I mean, unless you're someone whose only tools are a shot of Pen G and some prednisone, you know that understanding the process and the disease mechanism is quite important. And it's going to help you be a much better vet and a much better advocate for your patients. So, in my life coach line of work, clients come to me and on top of feeling anxious or even kind of depressed, they also have a lot of shame and confusion about why they are this way and why they feel this way. For many of us, we think that our brains are broken or that there's something wrong with us or our brains and that it's inherent and that in some way it just cannot be fixed. And the truth is, that's not true. There's actually a really specific set of reasons that many vets are so anxious. And that is why I want to explain them to you. And the takeaway from all of this is that the more you understand why your brain works the way that it does, the easier it will become for you to change it. So we all know that veterinarians experience anxiety, stress, pessimism, and hopelessness at relatively high levels compared to other professions, right? This is nothing new. We all know this. Some of us even move toward numbing out or substance abuse, right? I mean, think of all the stories that you see on Facebook or that you've heard from a friend. Something that I was actually pretty impressed by at the PAC Vet conference that I went to in San Francisco last month is that there was an entire lecture on alcoholism in vet med. It was very, very eye-opening and such a tender experience to be part of that conversation. And I really hope that we start seeing more of these types of talks coming into our conferences. The other thing that we're all familiar with is that we have a higher rate of suicide in our profession compared to other high-stress fields. We hear about it all the time. Another study gets published. You go to another lecture talking about suicide rates. You see another post on Facebook about someone in our community who has taken their own life. It's a commonly known issue. There are, of course, a couple of conventional explanations for this. But in my mind, it's just not that simple. That's not the whole story. However, these conventional explanations absolutely matter, so I am going to touch on them. The first explanation is that veterinarians, veterinary professionals, deal with sometimes quite depressing, sad situations. We see people's beloved pets when they are sick. We diagnose them with a terminal disease like cancer right after the client has received their own terminal diagnosis from their own doctor. We deal with the fallout of divorce and the sometimes negative impact that it has on our own patient and their care because neither pet parent is in a place to provide the continuity and follow-up that the patient needs. We have to present the option of life-saving care that a struggling family just cannot afford versus the option of euthanasia. So a lot of times, it is an exposure to traumatic stuff, right? And we hear about this. We talk about it in the vet med space. We're all familiar with compassion fatigue. So this type of secondary trauma and the experiences that we have as vets are very real. And in many times, we're being consulted in our professional capacities about a patient when their people, their humans, are often having the worst day of their lives. The second explanation that we hear about is that vets are dealing with an industry that has particularly stressful conditions. Think about the high workload, unpredictable hours, schedules, emergencies. Even though we got into this profession to help animals, if you're a veterinarian or a veterinary professional, your job is still very much client-oriented. It is service-based. People are paying us for what many of them consider for their families to be large amounts of money. And typically, they want a guaranteed outcome, and they want to be fit in when they want to be fit in, and they want you to be available 24/7. And I don't know if your experience is the same, but at least for me, this seems to have worsened post-COVID. Many of our hospitals are chronically understaffed. There are still back orders on very necessary medications. There are more pets to treat. And you're working in a field doing something that you really, really care about. And it just seems like there's never enough people or money or time or products to go around. So yeah, it can feel really stressful. And the idea with the second conventional explanation is that the way the current veterinary system is structured really contributes to the amount of stress that vet professionals feel and experience. And yes, just to be clear, I absolutely think both of these explanations are true. There are structural problems that can be solved for, and they are stressful conditions under which we work. But these two conventional explanations don't really fully explain the problem. However, they both definitely create situations in which it's easier for our brains to run wild and to get into that fight or flight mode. These are big challenges, and they can trigger us. And sometimes we go into that hyperactivated state, and other times we're there for so long that we start to burn out. But in addition to this, there are other explanations too. These are not the only two things that are causing our anxiety and our burnout. So how do we know this? Because there are some vets out there who are not stressed out all the time. There are people that we work with or we've seen who are not anxious and they're not agitated and they're not burning out. We've all met people like this. Somebody who seems totally unfazed. So we know that it's not just the external conditions. And in my experience, the reason that so many of us are stressed out is not that we're all working in the same stressful job, which I think is what most of us actually do think when we look around. We're like, well, I'm stressed out, but so is everybody else around me, so this is obviously just what it's supposed to be like being a vet. And I don't think that's true. That's kind of like when you say that correlation equals causation, right? That's inherently not true. I think that the reason that so many of us and those around us are stressed out is that we have doctor brains. So through my coaching work, what I've discovered is that the real problem for veterinary stress is the way that so many of us are trained to think. We are trained to think in specific ways, and these ways can sometimes get out of control, and then they create this unnecessary stress and anxiety. And that's what I'm talking about when I refer to your doctor brain. Your doctor brain has learned very specific ways of thinking and has been trained to do so in order to do its job. And these thought patterns and ways of thinking can start to run rampant, and they can become your default way of thinking about everything. And yes, in the current environment, it can absolutely be triggering. And in addition to that, because we are so logical and we like to problem solve and we enjoy practical solutions, we can actually unlearn a lot of this, and we can train our brains to work for us instead of against us in these already highly charged situations. So I think it's useful to break down what creates a doctor brain, what sustains it, and what are its effects. I think the first part of having a doctor brain happens before you even go to vet school. Think about the people who are drawn to pursue veterinary medicine. I think we tend to be people who are maybe a little more risk averse in our professional lives. We like to know there is a way for us to get a desired outcome for our patient. We didn't choose to go to business school and become venture capitalists. We chose something that seems logical. We are also predisposed to be perfectionists and to have anxiety. I'm looking at you, all of you former gifted and talented students. Many of us, not all of us, but I would say a substantial amount, also tend to be more introverted. We all hear stories like, I didn't pick this career because I wanted to network, or to navigate difficult client conversations, or to work with people. Ew. For the most part, many of us were like, I like animals, I like helping animals, I like science, I like logic and applying my logical thinking to solve problems. I'm going to use this to make a difference. So we have some of these characteristics and we're all excited to make a difference in the world as veterinarians, and then we're funneled into a very, very limited number of veterinary schools. There are many, many, many pre-vet programs out there, but there aren't as many options for vet school. So we come from a place of wanting to help and to make the world a better place, and then we're told that in order to do that, we have to outcompete all of these other people around us who are interested in doing the same thing. That, my friend, is automatically going to fuck with your brain and create this kind of scarcity mentality. We're presented with this very real reality that not everybody can go to vet school, and we create this sense of competition. We don't want to rely on our friends and our classmates and those around us when we need help because we don't want to appear weak or vulnerable, and we don't want to help them when they're feeling overwhelmed or struggling because it may give them an edge on their application, or get them that specific sought-after internship, or maybe they'll do better than us on the next exam. Our vet school options are limited, so we set ourselves up to very quickly absorb this scarcity mentality. There's not enough to go around, and everybody else is your competition. So you can see how we're primed and we're existing in this hyperactive nervous system state way before we ever get into vet school, and way before we ever graduate and start working in a professional capacity. And I think an interesting thing is that many of us, we're not really that stressed out about the idea that other people are competing with us. It's not like we're sitting there thinking that somebody's coming to get me and I need to do better than them. But what I actually see in a lot of people is that we feel like everybody else knows what they're doing, and I'm the only one who doesn't. So you can see how imposter syndrome can start breeding from a very, very early time as well. So it's not that we see ourselves in direct competition or comparison all the time with everybody around us. I mean, we logically know there is some degree to that because of the limited number of spots. But the thing that has a bigger effect than that is that we start to assume that everybody else around us knows what they're doing and is more accomplished or more deserving of their accomplishments. And then we look at ourselves and we tell ourselves that we're not as good as those other people around us. And we start to feel the sense of self-judgment, and we maybe start to believe that we're not as deserving as we actually are. And this in itself can create anxiety. So if you haven't listened to the episode on imposter syndrome, go check that one out too, because we talk a lot more about this in that episode. But just to summarize where we are, we have this idea that we're funneled into one of the only few potential schools, and this really does create a sense of scarcity, that there's not enough to go around, and as a result, we end up comparing ourselves to other people constantly. And then we get into vet school. And this is where our doctor brain really kicks into gear, because our training is designed to create good doctor brains. We learn about how things work, disease mechanisms, physiology, pharmacokinetics, all the things. And we learn and memorize them in ways that allow us to pass a test. And for a lot of us who are already perfectionists, we want to do that really well. We want to do really well on the test. But everybody else around us also wants to do really, really well on the test. And for some of us, suddenly average, or maybe don't even do as well as we used to compared to our classmates, which then only fuels this idea that everybody else around us must know what they're doing or somehow be smarter or better. Total breeding ground for anxiety. So we learn these algorithms, these ways of memorizing mechanisms of action, step-by-step approaches on how to diagnose and then to treat problems. And this is great. We need to know how to do this. That is our knowledge basis. But it doesn't always translate to the real world. Medicine is medicine. There are no guarantees that a treatment protocol will work or that we will get the outcome we want, even if we follow the recommended plan perfectly. So our doctor brains are constantly searching for the quote-unquote right treatment plan, the correct protocol to follow, the signs that classify this as one type of disease or problem versus another, the correct answer to get the correct result. But that's not life. And this is the part that is so hard for us to accept. The outcome, our patient's result, is actually outside of our control. No matter how well you aced those test questions on diabetes and how well you've set up your protocol, your patient may not respond in an expected manner. So our logical doctor brains are trying to piece together this puzzle that we know how to build, but suddenly the pieces don't fit anymore, or the picture we are trying to build has changed. And this is stressful and causes anxiety because now we start to think that we must be doing something wrong, that we somehow didn't learn enough, or we're not smart enough, or that everybody else is smarter and knows more. And even for those of us who eventually come to accept that not every patient follows the textbook, when we see that patient on our schedule with the chronic non-resolving ear infection, we still get anxious and frustrated because we think that we should have been able to fix it by now, or that another smarter doctor would have fixed it by now. And we become frustrated and anxious and start to be judgmental towards ourselves, which induces anxiety. So to recap, we are taught how to put puzzle pieces together and to solve a problem. And we are tested in ways that reinforce these puzzle pieces go together. And when you put them together, you get the right answer. But we are not taught a lot of emotional or mental tools to help us cope when those pieces don't fit. And because we are already perfection-oriented and we are comparing ourselves to our colleagues, we start to create anxiety within ourselves that we must just suck at being a vet. The third thing that I think really exacerbates our anxiety is the Socratic method of teaching that is often used in rounds. Picture this. You are in the clinic in rounds, and you're going to get called on and have to answer a question. And you don't know when you'll get called on, or if the question is one that you will actually know the answer to. Friend, I cannot even tell you how many times I knew the answer to all the questions that each of my peers had just been asked, and then whatever question I got, I just didn't know. Like seriously, how does this person manage to pick the one question that I'm not sure about? And when you combine this with being a risk-averse perfectionist, what you get is more anxiety. You are anxiety overloaded in a scenario where you now are facing public humiliation because you don't know the answer. And as vets, especially veterinary students, we're terrified of not knowing the answer, which really worsens when we add in our fear of making mistakes, right? Because if it's not okay to make a mistake and it's not okay to not know the answer, then what's the result? You have to be perfect and always know the answer and always be right. And that's perfectionism. Suffice to say that perfectionism is not a good thing for us. And I'm sure many of us already know and have experienced just how debilitating perfectionism can actually be. I am going to cover perfectionism in a little bit more detail in future episodes too, because it's such an insidious problem, and I think there's a lot of us out there who are closet perfectionists, but we don't really realize it, and we don't see how it's actually showing up in our day-to-day. So stay tuned for that because I think you're going to find it very interesting. Now, the next thing that we learn in vet school is that the stakes can be pretty high. If you make a mistake, if you don't ligate that vessel correctly, your patient can bleed out. If you miscalculate the dose of a drug, your patient can suffer or even die. If you don't recognize that this is actually an Addisonian crisis because your patient is a cat, or if you misdiagnose a problem or you fail to see that linear foreign body on X-rays, the result can be life and death. So if you make a mistake, a completely normal human thing to do, there can be extreme consequences. You're worried about malpractice, a board complaint, losing your license, being sued, slandered on the internet, on top of the fact that you already feel terrible because of the mistake that you just made. And yeah, this is a tough place to be because we do have professional responsibilities as doctors that are greater than those of people in other professions. This is a reality. And in already risk-averse, perfectionistic, anxious people, this can get out of control quite easily. Just the idea, the thought of making a mistake equals disaster and causes us massive anxiety. And this lens through which we view everything makes it harder for us to celebrate when things do go well. When we do save the pet or figure out that challenging problem. It's harder for us to acknowledge this and to celebrate because somewhere deep in the back of our minds, we are just anxiously waiting for that other shoe to drop. So yes, the reality is that our mistakes do carry heavy consequences at times. And this in turn dials up our anxiety even more. The other thing about vet school, which kind of relates back to that first conventional explanation about secondary trauma exposure in the workplace, is that when we're going through vet school, the patients that we are seeing have been brought to a teaching hospital where many times the clients have money to be there and are also highly invested in the care of their pet. And then once we're out in practice, we're not really prepared well for the reality of pet ownership. We see all of these sick and suffering animals, and sometimes the client just cannot afford the necessary care. And sometimes the client just doesn't care enough, even if they have the money to do anything about their pet. And we've all seen these types of pet owners, including those who don't adequately train their pets, or feed them properly, or just keep up with basic wellness and prevention. We've all felt that heartbreak when we see a pet succumb to a preventable disease, like heartworm, parvo puppies. What about those who chain their dog up outside 24/7 and it's covered in fleas and dirt and is just skin and bones? Or that client who, quote-unquote, rescues cats and has so many that they're all suffering from various treatable ailments, but they just don't have the money to care for them all because they have too many mouths to feed. It can be stressful to be placed in these situations, and also just to hear about them from other people. And this is not hospital related, but I do think it fits in here and deserves to be mentioned. And that is the number of Facebook groups out there that also perpetuate these types of traumatic experiences. These groups were created with the goal of offering support and creating community. The intention was good. But unfortunately, there are many that have just turned into echo chambers that perpetuate stories of suffering animals and terrible clients and toxic workplaces. And the biggest issue here is that when we are surrounded by these stories and cases about things going wrong, it trains our brain to overestimate the likelihood of these terrible things happening. We know from psychology literature that humans in general are very, very bad at estimating the likelihood of disasters. So when a disaster has not happened recently, it's pretty far from memory. And as humans, we tend to underestimate the chance that it will happen again. I live in California, so I think about the wildfires and how if we haven't had a wildfire in a while, people tend to become lax about the boundaries around their homes and keeping their shrubbery under control and taking down trees. And then on the opposite side, when a disaster has happened recently, such as a recent hurricane or even a terrorist attack, humans are way more likely to overestimate the likelihood of it happening again, and specifically to them. So then I think of these wildfires and how we're having a lot in the state at the moment, and how everybody now is suddenly so concerned about taking care of their properties. So on a day-to-day basis, we see many ways in which things can go wrong or are not ideal, and we start to unconsciously overestimate the possibility of all that stuff happening around us all the time, which sucks and further increases our anxiety. And this type of thinking and this anxiety can bleed over into our personal lives too. We are constantly scanning for things that can go wrong. We are thinking about the worst case scenario, looking for what's wrong or could go wrong in any situation, not just at work. We are comparing ourselves to others in regards to our personal lives. We think things like, maybe I'm just not that lovable or worth loving when we are single, and it seems like all of our friends are dating or getting married. We are scared to be vulnerable and to make mistakes in our daily lives because of how we may be judged or humiliated. Maybe you were late to your child's soccer game and now you're thinking that you're a bad parent. We can also fall into the trap of thinking that we must be useless and suck at our money management because we still have all of these loans to pay off while our non-vet friends are investing and buying houses and going on vacation. There's this constant narrative of, why does everyone else around me seem to be better off? How are they figuring out the pieces to this puzzle of life? And I'm still stuck. And these types of doubts, questions, the lenses through which we view life are associated with anxiety and burnout and depression. And no one teaches us how to rein it in. These neural pathways just get created and then they get more and more entrenched as we go through life and we keep thinking this way. And this can manifest in different ways, such as catastrophizing. We focus on what could go wrong instead of what could go right. It also manifests as pessimism. We look for and see the bad instead of the good. And of course, anxiety and imposter syndrome. We're constantly comparing ourselves to others and thinking other people are better than us or more deserving of us in both professional and personal capacities. We see hopelessness too. We don't see a way out, or we don't see how things could be different or better. And then we get this feeling of stuckness, feeling completely stuck, like you know there has got to be something better than this, but you just cannot see or know how to figure out a way to get there. And you can see how this creates the perfect storm of anxiety and overwhelm and exhaustion and eventually burnout and depression. And this unfortunately can sometimes lead us to the conclusion that maybe suicide is the only way out. What I hope you hear me on is that it doesn't always have to be this way. Just because we've trained our brains this way does not mean that it can never be undone. That is absolutely not true. And this is really the beauty of neuroplasticity. You can deprogram and reprogram your brain. There are skills that you can learn and tools that you can apply. If you learn how to manage and control your brain, then you can switch on your healthy doctor brain at work and use it in a way that serves you. And you can switch off your doctor brain at home and just be human. I hope that you can see and understand where your doctor brain comes from and how it was created. And also understand that the negative things that you're experiencing day to day are not an accurate reflection of reality. Your brain and your nervous system have been shaped throughout your childhood, your adolescence, your schooling, and now your career. You can learn to dissociate from your negative thoughts, not in a clinical sense of dissociation or what we talk about in compassion fatigue, but you can dissociate or distance yourself from continual anxiety, from the continual need for perfection, from your fear of failure, from just not feeling good enough. You can learn to distance and let go in a healthy way that allows you to recognize when your brain is running out of control. And then, once you've learned this, you can then learn to rein it in. you can learn to bring your healthy Dr. Brain online and use your amazing, capable, talented, smart, creative, problem-solving brain to your benefit. So I want to wrap up here by reminding you that there is nothing wrong with you for how you're thinking. This is how your brain has been trained to think, and it can be undone. It can be reversed. I know it can. I've done this for myself, and I've helped so many people with this too. This is the whole idea of neuroplasticity, and just knowing this can give you a sense of relief, right? There's nothing inherently natural or necessary about all the stress and anxiety you have, and it can be changed. It's just a product of the way you're thinking and how you were taught to evaluate the world and to think about things around you. And remembering this will really help you see that it doesn't have to always be this way. This isn't just the way it is. So if you want to learn to practice this a little bit and apply it to your own situation, I encourage you to download a free guide that I've created. It's an exercise workbook that doesn't take that long, and it's going to take you through learning to interact with and engage with your Dr. Brain to reduce some of your anxiety. Now, it's not only for Dr. Brains. Really, if you are a veterinary professional or any women experiencing burnout and this anxiety from work that's creeping into your life, this worksheet's for you too. This particular one focuses on catastrophizing, the concept where we worry unnecessarily about a potential future problem that may not even be a real problem or even come into existence. It's the act of imagining worst-case scenarios and outcomes, and that really, really affects our risk-averse, perfectionistic, anxiety-primed brains. So it's really, really easy to get the worksheet. Just go to the show notes and click on the link, and it'll be right there. You can also email me at vetcoach@daringdvm.com or send me a message on Instagram at Daring DVM, or come find me on LinkedIn as Dr. Amy Grimm. If you reach out to me and let me know that you would like the worksheet, I am more than happy to send it to you. And then let me know what you think. Download it, give it a try, and see what does your Dr. Brain get up to. Okay, my friends, that's a wrap. I love who you are, and even more than that, I love who you're becoming. Let's tame our anxious Dr. Brains. Dare to dream.